nurses here at the Center for Plastic and Reconstructive Surgery. I'm going to talk about pre-op and post-op instructions if you're having a separation of parts. It's also called, you might have heard, a bilateral muscle flap closure. So the night before surgery, you can have dinner, you can have something to drink up until midnight, but after midnight, nothing to eat or drink. You'll get up that next morning. The general surgeon's office may give you some wipes to use. You're going to use those wipes as instructed by them. You'll do that the night before. Anything they talk about, you do what they say. So that morning, get up, wear something comfortable, wear something with a loose-fitting waistband, like a drawstring or elastic waistband, so that once your incisions are done, that you don't have to have anything tight over your incisions. So 2 weeks before surgery, no Advil, Motrin, aspirin, Aleve, or Excedrin. You can take Tylenol, and you can take extra strength Tylenol for pain. Depending on what medications you take, I will tell you, or your nurse will tell you, what medications you can take that morning. The hospital will also call you a couple days before surgery to confirm your time and tell you exactly what time they want you to be there, and they'll go over your medications too. No makeup, no nail polish, no jewelry, no contacts. You can wear your glasses, and we'll give them to your family once you go back for surgery. For separation of parts, you're generally in the hospital anywhere from 1 to 3 days. It depends how you're feeling. They'll get you up in the hospital afterwards, and they just want you moving around, make sure you can take care of yourself. For your incisions, you are going to have 3 incisions. The general surgeon will fix your hernia through the center incision, and then Dr. Sherrick or Dr. Beal will make a smaller incision on each side of your abdomen. Generally, they're closing these incisions with buried sutures, and you'll have Dermabond tape over the top. It'll look like a purple piece of mesh with glue over the top. You leave that in place for 2 weeks. You don't have to do anything to it. You can get that wet 24 hours after surgery. At the base of each incision, you are going to have a drain. So they will be attached at the base, right where your pants hit. So that's why it's important to wear something comfortable. They will be hanging down. So while in the hospital, they'll give you a safety pin. They'll show you to hook it up against your pants. This is the part that will be inside of you. You won't have to do anything with that. On the drain, there's some graduated numbers. They'll teach you how to measure how much fluid is coming out. They'll give you a sheet that you'll mark down how much fluid is coming out. When you come see us, you'll bring that sheet with you, and that will let us know when it's safe to take your drains out. The drains will stay in anywhere from 1 to 3 weeks, occasionally longer. They will teach you how to make sure that you keep the drain clean. They'll make sure, they'll tell you never disconnect this section here. The only thing you'll ever do is open this area and empty out your fluid. You never want to irrigate this out either. So when you come to see us, like I said, bring your drain log with you if you want your drains out. Pain control, they'll see what works best for you in the hospital, and the general surgeon will prescribe pain medication before you leave. The pain medication will be constipating, so they'll start you on a stool softener while you're in the hospital, but we also recommend that you get an over-the-counter stool softener such as Colace for at-home use. As far as wound care, like I said, 24 hours after surgery, you can get all 3 incisions wet. You can also get your drains wet. One thing that works well is in the shower, if you can get a lanyard around your neck, take the safety pins, hook it to the lanyard, you can hang them there and have hands-free showering. If they hang down, it's not going to damage the drains, but it's going to be a little bit uncomfortable for you. Now, as far as restrictions go, you are going to have, for the first 2 weeks, no lifting more than 5 pounds. So a gallon of milk is 8 pounds. You're going to want to do less than a gallon of milk. And then from 2 weeks to 6 weeks, nothing more than 10 pounds, so a little bit more than a gallon of milk. As far as driving goes, when you're off the narcotics and when you feel like you have full range of motion, then we feel that we leave it up to you to see when you're able to drive. So at least plan on having somebody drive you to your first 2 post-op appointments. We generally see you 7 to 10 days out for your first appointment and 2 weeks at your second appointment. Your first appointment, hopefully we'll take at least 1 drain out. Your second appointment, hopefully we'll get the other 2 out, and we'll also take your tapes off at that time.
If you have any questions at all, just feel free to call our office. We are available 24/7, and there's always somebody here